It has been a back and forth for years. UW nurses wanting to be recognized as a union, but the healthcare provider says it can't because officials there believe it would break the law. Well, this is all coming to a head. The group representing hundreds of nurses filing a 10-day notice to strike.
In response, UW Health released this statement. This is unfortunate given that a strike will do nothing to alter the legal uncertainties surrounding the health system's ability to collectively bargain. The strike would start September 13th and last at least 3 days.
Tahlil Mohadeen heard from several nurses at UW today. And Tahlil, what are the nurses saying has changed here since they first threatened to strike?
When I spoke with union leaders, they used words like intimidation to explain how management has handled their latest demands to recognize their union, SEIU. They say despite pushback from the hospital, they're moving forward for their patients' sake.
They want us scared. They want us intimidated.
Nurses at UW Health say since they voted to strike last week, the response from hospital management has them worried about their job security and their patients.
We are not given the tools to do the job that we went to school for, is to take care of people.
They say managers have been calling staff into private meetings and asking them to sign documents that say whether they intend to strike, not strike, or are undecided.
It's scary. It's invading. They're pulling us from patient care to intimidate us.
Union leader Sherry Signer says management has also told nurses they would classify employee participation in the strike as a no-call, no-show, threatening to even fire some.
I'm not surprised whatsoever. We have been trying for years to get through to management. We have been trying to get to the board. We have been stopped. Every time we make an attempt, nobody is listening.
In a statement to News 3 Now, a UW Health spokesperson said the hospital does not retaliate for supporting unions, but they will continue to follow their policies regarding attendance, bullying, and patient care. Still, State Senator Melissa Agard, a longtime supporter of the union, says the hospital's response has been concerning.
Doing it one-on-one, that's not healthy. I don't think that's productive for care to the patients as well as how it is that employees should be treated.
And nurses say they're now more determined than ever to have their seat at the table, to bring a perspective they say only they can provide.
With nurses at the table, we can actually advocate for them to say what we feel is best.
That strike is now less than 2 weeks away, again planned for September 13th through the 16th, but it could stretch even longer.
And our neighbors to the west, the Minnesota Nurses Association announced today their intent to also strike for 3 days after failed negotiations over safe staffing and safe working conditions. At least 15,000 nurses will walk off their job next week. The Minnesota Nurses Association said they're overworked and understaffed and need more nurses to care for patients.